Thank you, Dr. Zhao, for that set of remarks. We now go deeper into the past, to the Georgetown repository of 25 years of pandemic policies. We are living in a transformational moment for epidemiology and public health. New tools, especially data analytics and data repositories, are enabling insights we could have only dreamt of even 5 years ago. Our principal investigator on the Georgetown study, Professor Rebecca Katz, has helped lead this revolution, pioneering at Georgetown Center for Global Health Science and Security new tools for understanding the relationship between health investment and health outcomes, as well as the role in this crisis of the effectiveness of local and state COVID policies. So it is my great pleasure to introduce Professor Katz, who is also an advisor to President-elect Biden's COVID task force, along with Professors Ellen Carlin and Dr. Ellie Graeden, to share the work of the repository of pandemic preparedness materials called Health Security Net. We are proud to share with you today.
So thank you so much for the kind introduction, Chris, and thank you to Schmidt for supporting this work. We're so pleased to be part of this esteemed group represented here, and I'm happy to be joined today by Drs. Ellie Graeden and Ellen Carlin to launch a new research tool for pandemic preparedness. As Chris mentioned, we call it Health Security Net. Next slide. Thank you. So as Chris said, I direct the Center for Global Health Science and Security, and many of us in the center have spent our careers working on building an evidence base and research platform for global health security and public health preparedness. And at the center, we've been working to advance global health security by creating tools and research to support effective decision-making. And this includes a focus on finding and interpreting the data in global health security to inform investments and actions, for ensuring that municipal level leaders have the resources they need to effectively respond to public health emergencies, focusing on global norms, governance, structures, and international law to improve preparedness and response, and also identifying how migrants, displaced persons, vulnerable populations, and the least resourced and non-permissive environments are impacted by and may exacerbate health security threats, as well as mapping the linkages between climate and disease, all so we can start to identify appropriate interventions. Next slide, please. So when Schmidt Futures contacted us about building out a library of pandemic-related documents, we were definitely of like minds. We had actually already been engaged in very similar efforts. But with Schmidt Futures support, we've now developed a publicly accessible, searchable database of nearly 1,300 pandemic-related records. This is very much a living library. We plan to capture additional resources over time. In fact, even this morning, we were identifying more to enter into the library. And we also intend to build out records that are specifically related to COVID. This initial collection includes items for the past 25 years. There are records published from 1995 to 2019. And in light of what we're experiencing with COVID-19, the purpose was to collate pre-existing warnings, evaluations, oversight efforts, strategies, technical guidance, and other documents that would help us identify the ways in which decision makers have been previously informed about pandemic risks and threats. So we view the library as having three key roles. The first is offering the first curated compilation of global health security writings and assessments prior to the COVID outbreak. And this is not just a repository of records. Each record has been reviewed by our researchers using a robust protocol. It is tagged with features like who published it, what broad topical area it represents, and what the outbreak, and what if there is an outbreak that it may be linked to. Second, we believe we are establishing an evidence base to enable pattern identification that may help us better understand preparedness and response dynamics. And third, we are trying to provide a foundation for the future. We can develop new and improved policies by using the many resources living in this database. And at this time, the library includes records from WHO, the World Organization for Animal Health, the Food and Agriculture Organization, United Nations General Assembly, the Security Council, the United States government, as well as NGOs, think tank sources, and journal literature. Next slide. So why should you care, and what can this do for you? Well, the library is a tool that can support any number of activities. It includes journalism research, historical studies, political science inquiries, development of policies, and education for the public. It is constructed with cross-disciplinary future research in mind, and it takes a One Health approach, hence the inclusion of OIE and FAO resources. And we hope that this spurs cross-disciplinary research and understanding in the One Health context. Next slide. So first, for those of you who like, we encourage you to play along by going to healthsecuritynet.org. And we're going to walk you through actually what this tool looks like, but it's important to know that the library is designed with the end user in mind. It offers a variety of tools by which the user can access documents of interest. So you can browse by category like topic, publisher, funder, year of publication, and several other filters. You can search by keyword of the user's choice, which will pull up any records with the word in the title, the description, or the first 1,000 words of the report itself when it's in a searchable PDF file. You can see the other documents that are related to the user's search. You can download all the data, and you can download PDFs, which are available for almost all the records. And finally, you can create bookmarks for items of interest so you can view them later. So with that, let me turn to Dr. Graeden, who will show you briefly a little bit more about how this works. Ellie?
Great. Thank you, Dr. Katz. So to support the rapid public access to this body of work, we've developed this online tool that Rebecca just started to walk through for the Global Health Security Library. As she mentioned, it is available now at healthsecuritynet.org using Chrome or other modern browsers. The site provides rapid access to information about the records themselves, but also provides documentation about how the library was compiled, provides a user guide, and ways to contact us with questions or to help us identify additional sources we should include. Next slide, please. As we walk through the library, you can review over 1,200 records, each tagged by the year published, specific events on which the record was focused, the topic area for the report or record itself, who published it, and their type of organization, and the funder of the work behind each record. You can then use the Explore page to move through those records based on those tags and to get a sense for the contents of the library and access additional information about each record. Next slide, please. As you open each record in the library, we then provide an overview. This includes the title and the author of the document, but also the publishing organization and key data about it. It includes a description of the record, whether it was that description of which is written by the research team to include a standard set of key information. We provide access to a preview of the document itself and download wherever the PDF is available, or we provide a link if not. All of this then provides also quick access to similar items in the library. And then a bookmark function supports the ability to store the information of specific interest for future use. You can also then download those records so that you can go access them rapidly later. Next slide, please. As you continue to explore and search the library further, you can then use the links on the page to filter by funders or other key descriptors of the reports and find related materials. So for example, as shown here, you can search and filter for any of the records funded by the American Medical Association and find National Academy's reports on international disaster response and others. Importantly, the library is designed to be expanded and to allow cross-reference, using these same key characteristics to the other data sets developed and maintained by the center as part of the infectious disease events and analysis platform. In addition to providing access to a curated library, Health Security Net has been specifically built to support deep analysis of this information, all captured in reports, which helps us to better understand the role of this type of information in improving and expanding upon our ability to prepare for and respond to pandemics in the future. I'd like to hand off to Dr. Carlin to walk through some of our key findings thus far. Next slide, please.
Next slide, please. Thanks, Dr. Graeden. I'd like to take just a few moments to show how a preliminary examination of the library's contents to date is leading to some initial impressions. While the library will continue to grow, even at this stage, it's beginning to reveal interesting patterns. The almost 1,300 records show us that documentation of the scope of pandemic threat and risk and activity to address it was widely available for the public and for those in a position to take action. When we uploaded these records, we attached broad categorical tags to each. So for instance, in orange on the left, you can see medical preparedness and emergency response. This was by far the most popular category, with nearly half of records having a predominant tie to this topic as documented by the researchers. This classification reflects records in areas like medical countermeasures, non-pharmaceutical interventions, medical training and workforce, hospital preparedness, and related items. Fewer records are dedicated to the other individual categories like surveillance or threat awareness, for instance. Next slide, please. When a record related to a specific disease event, we classified it as such. These were major events like SARS, MERS, Ebola, influenza, and other outbreaks. As you can see, the West Africa Ebola outbreak garnered twice as much or more attention among the records than did any of the other listed outbreaks, including the 2009 H1N1 pandemic you can see there in the middle, which took far more lives. Next slide, please. This figure gives us a sense of records over time. The black indicates records that were not related to a given outbreak, so that's most records. And the color coding shows specific outbreaks. Orange for SARS starting in 2003, H5N1 avian flu in dark pink beginning around 2005, and a heavy emphasis on Ebola there in yellow starting in 2014. We see a strong temporal association with the most current emergent situation. Not surprising, given that outbreaks represent current events by definition, but they do tend to be replaced when the next one comes along. An additional analysis of the records could examine, for instance, the extent to which activity continued to address some of these pathogens. What's in all of the black records? We haven't done that deeper content analysis. But you could ask, did interest in these pathogens continue or did it cease altogether when the outbreak was over? I can say we do know that there is a preponderance of records related to influenza in the database. We know that just from working with the records. And these weren't just related to influenza outbreaks, but their strategies and plans and other preparedness documents heavily concerned with planning for pandemic flu. Next slide, please. These last two charts divide the data set into its two major components, records published by global bodies and United States records. So up top, we see a reflection of international records over time from the World Health Organization, the United Nations, and others, and according to whether the record was about a specific outbreak. So again, like the data set at large, you see a lot of effort into reporting and writing on the Ebola outbreak. This really dominated WHO publications in 2014. You can also see MERS in green enter the narrative in latter years, starting in 2013, although it's a bit hard to see in the graph. The bottom chart shows US records. These are made up of congressional hearings, agency reports, and independent assessments, such as the National Academies of Science. We can see an initial spike in blue in 2001, representing the US anthrax attacks. We actually came across many bioterrorism-related hearings in the course of researching items for the library, but excluded these at least for now, focusing instead on outbreaks emerging from the natural world. We don't have any records specific to MERS outbreak reports among US records, although it is very likely that MERS does show up in domestic records, just not as a headliner. And finally, the library documents 160 congressional hearings, and these are largely the drivers of this sense of reactivity. These hearings are more than twice as likely to focus on a recent or ongoing outbreak than reports from federal agencies or think tank reports. So in closing, we hope these give a sense of some of the patterns we're seeing to date, and also the kinds of questions that the data in the database might help answer. With that, I'd like to turn it back to Dr. Katz for a wrap up on how all of this may benefit further research and policy making. Next slide, please.
Thanks, Ellen. So what Ellen just described was some of our preliminary descriptive analysis, but we really hope the library will be a tool to inform future analyses and Critical questions that need to be explored include: to what degree was the pandemic preparedness information known to and applied by experts and technical organizations? To what extent were recommendations acted upon? How did these decisions materially affect preparedness and response for COVID-19? And how can scholars learn from what was anticipated or articulated and what was not? And can we use the library to understand key historical questions or whether we can be better prepared? There's additional questions about how this body of knowledge might be applied to the implementation of future preparedness and response activities, and to what degree did the literature translate to success or failure in effective response? Next slide. So to help answer these, and Ellie made mention of this briefly, we've built Health Security Net as part of an integrated data architecture of related sources and tools. As I mentioned earlier, the center has been working on curating data sets and building research tools in health security for many years. And we're previewing this for you today. I expect it to be live by the end of this month. But we've been working to ensure that all of our tools and curated data sets, including the work we have that tracks commitments and disbursements in global health security funding, 40 years of disease outbreak news, metrics for global health security, and our tool that tracks the policies and law in COVID response, that these are all now linked under a single umbrella of what we're calling IDEA, International Disease and Events Analysis. This means researchers can easily link events and locations using a standard nomenclature. Next slide, please. So this is a call to action. We're very much hoping that many of you in this audience will use the database. We encourage interdisciplinary study of its contents and hope it will be a useful tool to support policy development, ongoing research, and new lines of inquiry. Please reach out to us if you have any questions, concerns, or recommendations for the inclusion of new material. Because as we've said, this is a living library and we expect it to continue to grow, especially as we work to capture the COVID-related records. Next slide, please. So on behalf of the three of us and our team of dedicated researchers and students, we want to thank you for your time and attention today. And please do go ahead and visit the site. Thank you.